I'm going to try to talk loud enough. I, it seems like I've been here a couple years almost, or it will be come October. And, I need to apologize that this is my first all-staff meeting. It's certainly, it feels like there's been just kind of one thing after another, and coming right before all this stuff with COVID hit, but it's no excuse. And I didn't want to take a lot of time today. There's quite a bit of things we probably could talk about, but I really wanted to talk about, well, there's two things I want to talk about, and then I want to give Dr. Regiris a chance to speak. But before I get into that, I just wanted to say thank you. I sincerely believe that people that live in a rural place, your residents, your patients, their family, their friends, their church members. And when you live in a big city, you're a name or a number. And I think people often forget that. They don't, when the regulations come down for Denver, Boulder, or Washington, they don't think of people like us. And what I see here is people that care very deeply for their community and wear multiple hats. Bigger places have multiple departments with multiple staff. Here, many of you where our departments are the same people are on multiple things. And again, I think this past year and a half has been filled with extreme circumstances. It's been filled with great hardships, both from the pandemic and the regulations that the pandemic has put upon us. But I sincerely want to thank you for all you do. Because without you, this community doesn't have health care. This nursing home that we're standing in the courtyard, where do these residents go? And as I talk about the next things I want to talk about, I think that's important to keep in mind. That's what we're here for. It's what I got in healthcare for originally. I know my grandpa used to tell me I should go into engineering because he thought I was good on the farm with mechanical stuff. And until this year, I always felt like I was meant to do healthcare. This year has made me question it, as I'm sure it has many of you. But this community without you, where would they go? So with that, I want to talk about two things that I know, one less controversial than the other. So I'll start with that one. The ballot this year has a question on it. It's going to be ballot question 1A. That question is asking for us to keep the tax levy that's already in place. This year, we have enough money to pay off the bonds that were used, among other things, to pay off the assisted living, or to build the assisted living. We have enough money to pay off those bonds this year. And we are asking the voters to be able to keep that same levy. Now, I guess the important thing is, nobody likes tax increases. So this is not a tax increase. And I think the other thing that's important, I know there's talk of, can we build a new nursing home? Can we do some stuff on the hospital? Can we find a way to connect these campuses so those of you that work amongst all of them, it makes it more efficient? Or walking residents over to the clinic makes it more efficient. I don't know if we'll be able to do that or not, but we're going to try. But one thing I do know, whether we do that or not, we're going to need money. And that money from that payment will help us be able to possibly build new, and if not, at least keep this infrastructure going as long as we possibly can for this community. So please, when you're talking to your friends, your family, yourselves, the important thing is it's not a tax increase. It is just, you're already paying it, it's just asking us to keep it so we can continue using it for these services. And then the next one. And really, you can say anything to me, I'm not going to be hurt, I'm not going to be mad. I myself am angry. I think that the vaccine mandates infringes on our own personal rights. I understand. I see both sides. But at the end of the day, and I haven't even looked here who has it and who doesn't have it. I know I'm going to have to, probably within the next couple of weeks as we're looking at filing state waivers. But for right now, I know that there's 46 of us in the facilities that don't have it. If we can't find a way to meet this regulation, I worry that we're not going to be here long term. Because if 46 people walk, there's no way we're going to be able to offer services for the community. And I'm not trying to sound scary or fearful. It's just a reality. And honestly, I don't think the state cares. I don't think the feds care. And I don't want to make it political, because illnesses, health conditions, they're not political. But the reality is, if it's not us caring for these people and these residents and this community, who's it going to be? And I guess I say that to say I don't like personal rights being infringed upon on anything, but I also think the vaccine is safe. I have done it myself. My wife has done it. My oldest daughter's done it. But that's a personal choice I made. And I'm asking you to please look at the bigger picture here when you have to make this decision yourself. Because what I'm understanding, and these rules are changing as, probably by the time I go back to my office, there'll be something new to read. But right now they're telling us that Center for Medicare and Medicaid, which is basically a big chunk of how we get paid and how we're able to pay everybody's salaries, they're not going to pay us unless we comply. And I'd like to say I can do something about it. I can reach out to and I've talked, I tried to talk at the CDPHE, the Colorado Department of Public Health hearing 2 Mondays ago, but they shut off comments because I think they already had their mind made up. And now with what the feds did yesterday, I feel like we're fighting the tide. So again, it comes back to, what are we going to do for this community? And I hope that you guys, all of you, will take that into consideration into figuring out what you want to do for yourself. I understand either way, but I'm asking you to look at that bigger picture. And I'll take some questions afterwards, but I asked Dr. Revere, who's probably been in this community practicing medicine longer than most of us have worked here for sure. Probably at least some of us have been alive, but maybe it was destiny. So I asked Dr. because I think our medical staff is all feeling that the vaccine is safe. And again, I'll let Dr. Revere say a few words, and then I'll take questions.
Don't have a lot to say. There's a lot of factors that weigh into each person's decision, but when it really comes down to it, it's the best thing we have. Might not be ideal for everybody, but at the same time, it's the best thing we have for our protection, and it's the best thing we have to protect those around us, especially those that are more susceptible than we are. Again, nobody likes to be told what to do, and those, people have resistance in that, but put all that aside, you think of the community, why we're here, who we're here for. It's the best alternative we have. That's about all I can say.
And I've been here longer than you, Dr. Revere.
Thank you. Yeah.
Dr. Revere,
Yep.
are you aware of the early therapeutics that a lot of the doctors, like the American Association of Physicians and Surgeons, is promoting the ivermectins, the hydroxychloroquine? that are, they feel like in this four pillar